This video provides instruction on how to schedule appointments and how to engage with the appointments scheduled in ACE. The schedule is the dashboard for Clinical ACE, and all billable clinical documentation in ACE is initiated from the schedule. Successful caseload management can be achieved by maximizing the schedule features. Let's take a closer look. The user will begin by logging into Clinical ACE. The username consists of the first initial and the last name, and the password is the first 4 letters of the user's last name and the last 4 digits of the user's social security number. The ACE schedule will default to the current work week. To schedule an appointment, tap on the desired day and time. In this example, Tuesday at 9 a.m. is chosen. The appointment box will appear, and ACE will make several assumptions. The day and time of the appointment being scheduled would be based upon the location tapped on the schedule. Additionally, ACE will default to a type of treatment. Treatment is the type of appointment most often scheduled in ACE, and ACE has been designed to default to the most frequently used choices to save the clinical user time and effort. To change the type of appointment to something other than treatment, the user will tap the drop-down arrow. Once the drop-down arrow has been selected, a list of other appointment types will appear. The user may choose the appropriate type of appointment being scheduled. In this example, we're going to schedule a treatment. Notice the date of the appointment and the start and end times. Treatment appointments default to a 30-minute block of time, but this can and should be adjusted as needed by the clinical user. The user may tap the patient drop-down list to scroll and identify the patient for whom the treatment visit is being scheduled. Alternatively, the user may choose to utilize ACE's IntelliSense programming by typing the patient's name into the patient field, and ACE will automatically show a list of suggested patient names. The user will identify the appropriate patient by tapping on the name to select the patient. The user also has the option of identifying the scheduled location of the treatment appointment from the drop-down list. The place of service location addresses in this list are the ones that are identified on the patient record under the Service Details tab. When the appointment information is entered fully on a future appointment date, the user has the opportunity to make the appointment recurring by selecting the recurring box to the right of the start time. For patients who are regularly scheduled, this will save the user time and effort by continuing the standing appointment in the future. When the user checks the recurring option, ACE automatically defaults to a weekly recurring appointment. To change the frequency of the recurring appointment, tap the drop-down box. The drop-down menu will allow the user to choose from other frequency options, such as daily, monthly, or every other week recurring appointments. The user can choose to have recurring appointments that end after a specific number of occurrences. In this example, we're going to create a Tuesday at 9 a.m. weekly recurring appointment that will end after 26 occurrences. The user may choose to enter appointment notes for specific instructions for that date of service. The appointment notes will not show on recurring appointments. When all information is entered, tap the Save and Close button. Alternatively, the user can also choose for the recurring appointment to end by a specific date. The appointment will now appear on the ACE schedule on the date identified. To ensure that the appointment is recurring, the user may tap the Next Week button. By tapping this button, the user will navigate through their upcoming schedule, and they'll see the recurring visit scheduled for the next 26 occurrences. It's important to note that for a patient that is typically seen twice a week, maybe such as Tuesdays and Thursdays, the user would first schedule a recurring appointment on Tuesdays with 26 occurrences, and then separately schedule a recurring appointment on Thursdays for 26 occurrences, assuming that the authorization is for 52 visits. Recurring visits allow the clinical user to build their schedule based upon their unique scheduling criteria for each patient on their caseload. This allows the clinical user to incorporate maximum efficiency into their caseload management. In the event that the user needs to delete or adjust the day or time of an appointment, tap on the appointment. The appointment box will open, and the user may tap the Delete button to delete the appointment. The user will then have options to delete only this occurrence, delete all occurrences, or cancel delete. When the user chooses to edit a recurring appointment, they will have the same options to edit only this occurrence, edit all occurrences, or cancel the edit. The ACE schedule has a type of appointment called a reminder that's useful for all users. A reminder appointment is a placeholder on a specific day and time slot to help the clinical user manage their day, responsibilities, and caseload. Reminders can be used for personal and/or professional placeholders in your work week and can be added before, during, and after traditional work hours. To set a reminder, tap the day and time. The appointment box will appear, and the user will change the type of appointment to Reminder. The user will enter the information into the subject field that will appear on the appointment. ACE defaults to a 30-minute time slot, but the user can alter the start or end time as needed. When complete, tap Save and Close. The reminder appointment will appear in light blue as a placeholder on the clinical user's schedule. Again, a reminder can also indicate a personal appointment, scheduled vacation time, or even a sick day. In order to schedule an evaluation appointment, the user will once again tap on the day and time of the appointment. The user will select the patient, place of service location, the type appointment evaluation, and enter any appointment notes as necessary. Keep in mind that appointment notes are essentially a reminder or self-note for the clinician regarding the appointment. These notes don't go anywhere, and they do not appear on any documentation. They are only informative for the clinical user. Once all items have been entered, the user may tap Save and Close. The evaluation appointment will now appear on the schedule in gray because it is a scheduled appointment that has not yet occurred. Appointments will change to red after the time of the appointment has passed. This automatic program action visually alerts the user that it is an undocumented appointment. A pencil icon will appear when the user has begun entering some documentation information. During the work week, the clinical ACE user schedule will be full of appointments and reminders in various stages of completion. The color-coded appointments are a visual alert to the clinical user and supervisor of a clinician's documentation status. Both the clinician and the supervisor can easily see what needs to be documented and what is complete based upon the color coding that is identified on the schedule. A gray appointment is a scheduled appointment where the appointment has not yet occurred. It's a future appointment. This is another compliance feature of ACE. The user cannot accidentally document visits that have not yet occurred. Green appointments are documented and synced. Green means keep going. You're doing a great job. Yellow appointments are documented but have not yet been synced. Yellow means caution. There's still another step left. Sync your device. Red appointments are undocumented, but they may have a pencil icon, meaning that some documentation from the session has been started. Red means stop. This appointment needs your attention. Light blue appointments are simply reminders for the user. At the time of this schedule, there are no purple appointments that represent missed visits. That's because this clinical user waits until the end of the week to document missed visits. Clinical users should wait to document missed visits until the end of the week, allowing for the appointment to be rescheduled to another day or time in the same week. If at the end of the week the service is not delivered in compliance with a plan of care frequency, the clinical user will then document a missed visit note. It's important for the user to remember, go for the green. Green status means that you can keep going, that your documentation is complete, and that you will be paid for the services that you've delivered. At the end of each work week, your schedule should include only green, completed and synced visits, purple, missed visits, and light blue reminders. For evaluation appointments that are not completed due to a cancellation or no-show, the evaluation appointment is deleted, and the user can enter a reminder showing that an evaluation was scheduled in that time slot but did not complete. The clinical user should then document the missed evaluation in a medical record note, and we'll talk more about that later. This concludes the appointment scheduling instructions for Clinical ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written Clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.